Hi, my name is Lincoln Kincaid. I'm the founding owner of Physical Therapy and Balance Centers. And today I want to help you figure out what to do if you have plantar fasciitis. It's a very confusing term for some people and it's hard for a lot of us to say. But basically, the plantar fascia is thick connective tissue on the bottom of the foot that supports the arch. Sometimes people get out of bed and those first couple of steps are amazingly painful. People will complain of pain right here in the below the primary bone in your foot. If you push in there and you've got some tenderness, chances are you may have plantar fasciitis, but as I just mentioned, the telltale sign is if you get out of bed and those first couple of steps are extremely painful. But before we go any further, I'd like you to take a moment, like this video, and subscribe to my channel so I can continue to help you with lots of helpful tips every single week. Today, I want you to know that one of the most important things you can do if you have plantar fasciitis is to get a resting night splint. This comes on Amazon. You can get a dozen different brands. There are a lot of soft brands out there now, but I really don't like those. These are difficult to sleep in, but it's the best. Hard plastic background. It's got a cushioned liner here. Again, it's a resting night splint. So the way you use this is your foot goes right in it. And yes, you do sleep in it all night long. A couple nights, you'll get used to it. I tell people, if you wake up in extreme pain because you've applied too much pressure with the strapping, just take it off for the rest of the night. Tomorrow night when you start, decrease the tension on the straps, but it will take you a few nights to get through a full night. So my foot goes right in this, and then I've got just connective straps all the way around it that kind of anchor me into position. So I'm not going to put all of these on, but for you, the important thing is after you get all three straps on, your heel should be anchored down in the crevice, basically, in the splint. It should not be painful, because it's painful when you start. It's going to get really painful through the night. So the key here, a little bit of pressure over a long period of time helps stretch the tissues on the bottom of the foot, as well as a gentle stretch on some of the muscles coming down your calf muscle and another muscle underneath the calf that's called the soleus. So that's the number one thing I have all my patients with plantar fasciitis do. The second thing I really like to do with people is a little bit of massage with a lacrosse ball. So there are really two things you can do here. This is a $2 lacrosse ball from Walmart, I think. But you can use a lacrosse ball, or you can freeze a bottle of water. That way you get the benefits of some massage and the cold. But anyway, with the lacrosse ball, I've got it on the ground, and I put my heel right on the ball, and I'm moving my foot back and forth, kind of rocking back and forth over the ball, and I'll go back and forth a little bit, finding some sticky points in there, little tender points, just doing a little bit of massage. Don't beat yourself up with this, because you can make yourself really, really sore. The third thing I like to have everybody do is just a simple stretch for one of the tendons that comes out of the back of your leg through the back of your ankle and attaches to the big toe. So setting right here like this, you pull the foot back a little bit, and I'm just pulling that big toe back, and you'll feel a stretch through here. Some people feel it really up into the toes. I do not want you to cause pain in the joint here on the big toe. But I'll pull that back, stretch here, a little stretch there, and I'm going to hold that for 20 to 30 seconds. I'm going to relax for a couple of moments, move it around, and then I'm going to do it again. So 2 repetitions, 30 seconds on this with the lacrosse ball massage. 2 or 3 minutes is adequate, and then try to build yourself up to spending an entire night in the resting night splint. You do these things for a few days, I'm sure you'll start to feel a difference. If you have any questions, just leave them in the comments below and I'll get back to you as quickly as I can. I hope you find this video beneficial, and look out next week when I'll have another great video coming out there to help you.